The Bay Area seeing a spike in coronavirus cases. California health officials are now concerned that this may be the state's new hotspot. Alameda County, home to Oakland and the East Bay, reporting more than 2,000 cases and nearly 100 deaths. And as NBC News correspondent Jacob Ward explains, this is happening while the state continues to reopen.
You'll recall that the 9 counties of the Bay Area, including Alameda County, Oakland, where I am now, were really the cutting edge of the lockdown strategy in the United States. This place sheltered in place first. But now, of course, what we're seeing is an uptick in this region, which is a disappointment to those of us who worked so hard so early to try and stem the tide of this thing. What it shows is that a week in which we've seen the greatest number of cases yet here in Alameda, 453 last week, is also an indication that this is not going to be one clean line on the curve. It's not going to descend in the sort of steady way that we had hoped. Instead, it's going to be, as it has around the world, an up and down roller coaster that hopefully moves overall in the correct direction. We have seen in California a steady reduction in the number of deaths and overall good signs. But what we're seeing here in the Bay Area in particular is possibly the effects of some of the reopening we've seen. Construction sites were reopened May 4th. People came out for Memorial Day weekend. All sorts of things may be contributing to this overall uptick in cases. But again, hopefully the general picture continues to go down. Also important to remember that California as a state is by and large opening itself up at the moment. But now here in the Bay Area and in LA County, we are still as locked down as we have been. Jake Ward, NBC News, Oakland.
COVID-19 may never go away, even with a vaccine. Some experts say the virus might become an endemic, but that doesn't mean it will be this dangerous forever. Joining me now, Dr. Vin Gupta, a pulmonologist who's treated critically ill COVID-19 patients at the University of Washington Medical Center, Dr. Gupta, first, this was an epidemic, then a pandemic, now an endemic potentially. What is an endemic for people who are getting a little confused here?
A really good question. Endemic basically means that we live with the disease. It's chronic, it's simmering, it's always there in the background. And that's the idea of a disease that's taken root in a community, that we can't truly get rid of it, just like we can't truly get rid of influenza, flu, which is seasonal. We can't truly get rid of the common cold. So the idea here is that COVID-19 is probably going to have a prevalence rate in our communities throughout the country, throughout the world, of a few percent points, depending on the season. And we're not really going to truly get rid of it.
You wrote an op-ed for NBC News saying governors should pass laws making masks mandatory. Today, New York Governor Andrew Cuomo announced an executive order that lets businesses deny service to people who will not wear a mask inside. Why do you think that mandatory masks are the answer?
You know, unfortunately, it just takes one individual in an indoor setting, or frankly, just in an outdoor setting where it's hard to socially distance, to ruin it for the rest of us. This is not one of those things where 8 in every 10 people, if they do something, whether it's stop smoking inside or wear a mask because we have COVID all around us, then that's going to do the trick. We need universal cooperation on this. And then you know what? If we get that, we're going to really tamp down transmission rates, because that's what Japan is enjoying. That's what Hong Kong's enjoying. That's what every model suggests could happen here. Because we don't have a magic bullet. There's no this notion that we have a vaccine on the horizon, that somehow that's going to save us. Turns out all the vaccine trials have bottlenecks ahead of us. I appreciate Dr. Fauci's optimism, but we have to look at vaccines. We have to look at therapeutics like remdesivir realistically and say the overwhelming likelihood is that's not going to save us come the fall. What's going to save us is infection control at the top of mind. And what the first and foremost thing for any respiratory pathogen as easily transmissible as COVID-19 is protecting our noses and our mouths from droplet transmission. It just turns out, normal speak, in a restaurant, that can spray an entire restaurant full of diners very easily in 10 minutes. If somebody's infected with COVID-19, doesn't know it, and they're just talking without a cover, they can infect an entire room. So that's why this is so important, and we need to compel it, not just suggest it.
The CDC released new guidelines this week for going back to the office. Those guidelines include wearing a mask, but also no handshakes, temperature checks. These guidelines are also similar for going back to school. If we are living with this pandemic long term, if it does in fact become an endemic, what do we need to be thinking about beyond these guidelines as we try to go back to work and go back to school?
Well, I think this is a good start. If everybody in the workplace can adopt those measures, wow, we're off to the races. And I think that's going to do a lot to tamp down transmission, because we know most people are transmitting this disease without even knowing they have COVID-19. So that's a win right there. That if everybody adopts that, fantastic. That's step one. And then step two there then is this hope that we're going to have a vaccine, or we're going to have natural herd immunity set in, because nothing we do is going to be perfect. And that hopefully we have either built-in immunity because we're all getting exposed to it to some degree, and or we have a vaccine in the pipeline sometime in 2021. To your question, listen, no, I don't think anybody has a true answer to that question. It's a tough question to forecast, but I think employers are going to move towards a telework environment. We're going to see a lot more people engaging with primary health care in a virtual environment. We're going to see a lot more employers say, stay at home unless you absolutely need to come to work. So we're talking about a smaller section of individuals, essential workers, grocery store clerks, nurses, docs, respiratory therapists, what have you, postal workers, who are really going to need to focus on infection control. But I think a lot of us will be able to stay at home and do telework. And you're seeing Facebook, Zillow, Gates Foundation, others really think about that as a strategy longer term.
Yeah, I think we are going to see some big lifestyle changes, working changes for sure, as you've said. Dr. Gupta, thanks for spending the time with us today.
Thanks for having me.
College students are taking their schools to court over tuition. Most of these lawsuits claim the students paid for an on-campus experience and they didn't fully get that in their spring semester because of the coronavirus, so they should at least get a partial refund. NBC News legal analyst Danny Savalos is joining me now. And Danny, do these lawsuits have any merit? What's your legal opinion here?
These lawsuits are going to force America to answer a question we've really left unanswered for a long time, which is, what are we actually paying for with our tuition? Are we paying for just pure information, or are we paying for the college experience? And then also factoring in is the fact that colleges have had online programs for some time. Full disclosure, I'm an adjunct online professor at Drexel University, which is one of the defendants, and my wife is a professor at University of Florida, which is one of the defendants. So the question that no matter what we have to answer as a society is, what is that college experience, and what do we pay for it? And what are colleges selling? After all, in the contract that they provide to students, they may advertise the college experience, but is that being on campus part of the contract that students enter into?
Danny, a lot of students had to switch to online classes, but they likely paid on-campus fees at the start of the semester. How do colleges and universities defend keeping that money? And I'm guessing we're talking about things here like room and board and some of those other kind of fees that you pay for that on-campus experience?
The plaintiff's argument here is going to be, I did not get the benefit of my bargain when I contracted with this college to get this entire total package experience. Expect the universities and colleges to counter with traditional contract defenses like, look, there was what we call a force majeure, something totally unexpected, or it's impossible for us to perform our end of the bargain to the degree that you're asking. In fact, nobody can do what you're asking, which is bring everybody back to campus. So we're doing the best that any college can do, and therefore we are keeping up our side of the bargain by allowing there to be college classes just online, because that's the only safe thing to do. And so, I mean, realistically, colleges have infrastructures they still need to pay for, whether students are there or not. So colleges need to find reasons to be able to retain as much of the tuition that they can under the contract.
Right.
But look for these disputes to decide a long unanswered question, which is, what did we pay for when we spent all that money on tuition?
Danny, my dad asks that question about my college education all the time. Is there anything binding here? And I know that's part of what we're looking at, but is there anything binding here that says that the schools have to provide on-campus classes?
It's very interesting because it is ultimately a contract, and it's governed by the terms of each contract that each student entered into. And who the heck ever looked at any contract that they signed with the university? And on the one hand, while universities advertise the total experience, after all, they're doing everything they can to get you to come to their campus. So they're going to show all the beautiful gyms and the off-campus or on-campus activities that they have, the sports and everything else. And now they're not going to provide those. Well, what will be critical is whether the university promised that in some legally enforceable agreement, or if it was just part of the general advertising and a court decides that didn't really factor into what the student was actually paying for. It is a question that really, I think, on both sides, people have different interpretations of what tuition goes to.
Yeah. Danny, there are now dozens of class action lawsuits against colleges and universities. What does it mean for people who don't know to reach the level of a class action suit? And does that help the student's case in any way?
Yeah, these are going to be pretty massive if they're approved. Class actions have to be approved, but they're a vehicle that was created several years ago to allow multiple, when you have a lot of plaintiffs and they have very common claims, and it's such that if you had each of these thousands of plaintiffs file individual lawsuits, it would make a mess of the courts. As long as they have similar enough injuries, then the court will allow them to proceed as a class. And in this case, it seems like it's a classic, I hate to use the pun, a classic class, even though it's an incoming class of students. It's a class because they all are paying about the same tuition, and they're all being denied the same thing, which is this on-campus experience. And whatever value that is probably going to be pretty similar across the board. So this is likely to get approved as a class action and proceed. And when you think about the amount of money at stake, this is not a class action where each plaintiff of thousands has a 50-cent claim that's aggregated. Each of them has a pretty big claim in the form of college tuition, which all of our parents know is a lot of money, especially if you go out of state.
Right. Danny, I think we set a new record today for use of the word class in one single legal segment here. Very impressive work. Thanks for being with us. If it was a drinking game every time we said it, I think people would be in pretty rough shape right now. Thanks so much, Danny. Great to have you.
We're very classy, I guess.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.